Saya nak tanya, recently my friend went to a surgeon sebab sakit tangan, and the surgeon said she has double crush syndrome, and she was very shocked because she said last she had crush was in school and now don't know what the surgeon is talking about crushes and all that. Sekali lagi kita dalam You Sihat Podcast bersama-sama dengan doktor-doktor pakar di Columbia Asia Hospital Cheras. Kali ni kita bersama dengan Dr. Jeyasilan, pakar tangan, hand and microsurgeon. Correct doktor?
Yes, hand and microsurgery.
So, doktor pakar tangan ni, what do you do? What's your specialty?
Basically, I handle anything to do with upper limb injuries, mostly vascular, nerve, tendon, artery, bony injuries, ligament.
But sebelum Dr. Silan jadi doktor pakar tangan, before you became hand surgeon, you've handled all other ortopedik juga kan?
Yes, I started off general orthopedic, then I subspecialized into hand and microsurgery, which was another 3 years program after you finish your masters in orthopedics.
Saya nak tanya soalan yang very common among netizens or people in digital era for now, which is selalu kebas tangan, selalu rasa macam numb, and this is much related dengan using phone and computer. That's why I said digital era. Biasanya why this happen? Adakah the duration of penggunaan computer, keyboard dan phone, ataupun position yang menyebabkan sakit dan kebas sebegini, doktor?
Kebas tangan ni multiple reason. One of the risk factors, I won't say the cause, one of the risk factors is occupational hazard, or menggunakan too long the handphone or too long of your typing, your sitting position is not right, keyboard yang bukan ergonomic, mouse yang bukan ergonomic. So these are all risk factors, but these are not something that can cause carpal tunnel or nerve impingement. Yeah, certain pekerjaan seperti the one who breaks the drill that breaks the road, construction workers, yeah, those are the vibration movement in a higher risk of compressive neuropathies.
Just now you said this could be risk factors to carpal tunnel. Jadi as layman, we are very confused. Bila kebas saya ni, it's a normal kebas because of posture. Yang mana lepas 1-2 hari ataupun lepas urut dia boleh hilang. Yang mana satu sakit ataupun kebas yang berkaitan dengan real diagnosis macam carpal tunnel syndrome. How can we know?
Firstly, kalau symptoms tu very quickly goes off, then most probably it's just positional. Even with simple physio dengan rest, they can recover. But kalau symptoms tu recurrence, you rehat, dia okay. Lepas tu you buat balik aktiviti yang sama, dia jadi balik. Or every time you wake up at night, sometimes you have to wake up because terlalu sakit. These are warning signs. So, and this kind of numbness usually they follow certain specific distribution.
Macam mana pula? Tadi doktor kata you have to wake up because you sakit. What if somebody terbangun daripada tidur because kebas?
Yes, that's what I meant. If kadang-kadang patient tak boleh tidur, they already sleeping, they suddenly wake up because it's too numbness and they feel like a tingling sensation, macam semut-semut. They will come very specific kind of complaint. So these are all warning sign.
Kalau macam tu dah kena jumpa doktor lah sepatutnya.
Yeah, so these are the carpal tunnel or any nerve compressive neuropathy.
Kalau lah contohnya orang tu dia ada kebas dekat shoulder, kebas dekat wrist, sakit-sakit dekat jari-jari. Biasanya layman ataupun netizen di Malaysia akan pergi ChatGPT, Google, tanya, bagi tahu simptom, nak tahu saya ni carpal tunnel syndrome ke, tendinitis ke, capsulitis ke, the Google or ChatGPT akan bagi some diagnosis. Sebagai pakar tangan, how do you differentiate apa history taking ataupun examination yang doktor buat, apa x-rays ataupun imaging yang doktor buat untuk membezakan condition sebegini?
Nerve injuries or nerve compressive neuropathies, they can follow pattern. Kalau this particular nerve is being compressed, memang certain part area of the fingers or hand will be numb. So you have to look for those pattern. Kalau inflammation or anything, usually it follows certain trauma or certain kind of positional variation. It's a whole history taking and clinical examination. Certain group, females, 40s, slightly obese, those people are slightly higher risk in a certain kind of pathology. But saying that, so I'm nowadays with the current era and everything, I've even seen 20 years old guys with carpal tunnel. So these are very specific on ulnar nerve compression. So when I ask them what they do, they are rider. The rider, so they are long time riding motorbike in a certain position, vibration, they'll have a compressive neuropathy over the ulnar nerve. I even see it in carpal nerve, median nerve. These kind of patients, normally surgery is not solution because we know the cause. The cause is because they're riding motorbike. So all he has to do is modify the work occupation, wear certain kind of brace, change his position while riding the motorbike. Symptoms will get relieved.
Saya nak tanya, recently my friend went to a surgeon sebab sakit tangan, and the surgeon said she has double crush syndrome, and she was very shocked because she said last she had crush was in school school and now don't know what the surgeon is talking about, crushes and all that. Boleh tak doktor terangkan sedikit, what is double crush syndrome?
Double crush syndrome is not that rare. It occurs around 20 to 30% of the population. I mean, with carpal tunnel or median any nerve compression. It basically means there is more than one side of nerve compression. We must really examine, because when patient comes to me complaining of carpal tunnel, like you said, they already done their research. Maybe they visited GP referred to me, or they already checked GPT and everything. So sometimes they won't have the classic pattern. This happens because the lesion is higher. Not all numbness in the hand, even though carpal tunnel is the most common. Not everything we say is carpal tunnel. Sometimes the lesion could be more proximal. So it could be, from elbow region itself, you got 5 places where the nerve get compressed, or it's coming from higher lesion like neck. The nerve actually arises from the nerve root, and then nerve distributes and comes to the upper limb and supplies the hand and fingers. The nerve can get compressed anywhere. I'm sure you heard about cervical spondylosis. Our spine surgeon always talks about it. Some patient will come with typical carpal tunnel syndrome, but the lesion is actually in the neck.
So yang tu siapa yang rawat? Spine surgeon ke hand surgeon?
Both of us will go through it. So this is what we call double crush syndrome. Commonly, if the double crush, I'll refer to the spine team, and then if the spine surgeon thinks I need a hand referral, and they will refer to me. So it's very common to see these kind of patients. Normally, we have to treat both.
Treat tu apa maksud dia, doktor? Bedah ke, ubat ke, vitamin ke, urut ke, apa dia?
Most of the time, carpal tunnel is bracing and physiotherapy. Almost quite a number of the patient will recover with just 2. If you say the patient have to go for surgery, it's also a minor decay procedure which can be done. In the case of a double crush syndrome, obviously we talk to the patient which one you want to treat first. They'll ask for the hand first because it's more straightforward, easier to settle, and they will have a good recovery with carpal tunnel release. Right. But of course, the recovery won't be complete because they still have another lesion in the neck. That's why we need to have 2 teams working on them, the hand surgeon and the spine surgeon.
I just nak fokus sikit tu carpal tunnel, doktor. Kalau doktor nak terangkan sedikit tentang carpal tunnel syndrome dan juga rawatan carpal tunnel ni to our viewers so that diorang faham what difference it makes by doing surgery for carpal tunnel.
So normally the carpal tunnel release is done when conservative fails, because nowadays I say now we are seeing patients very early 20s 30s. I'm already seeing carpal tunnel syndrome. Simple modification of position, like hand position, like you're working, ergonomic keyboard, ergonomic mouse, proper chair, the way you sit, all this can alleviate the symptoms. Those people who have done all this and with the bracing, physiotherapy, symptoms does not resolve. So we suggest for carpal tunnel release.
Apa tu? Doktor release apa tu?
We release a transverse carpal ligament. So it's a small fascia that goes in the palm. Kita panggil carpal tunnel sebab bawah tu ada a couple bones, and then on top of it we have the transverse carpal ligament. So due to aging factor, some pregnancy related, ruang or space dalam tu dia akan kecut. So transverse carpal ligament dia kecut dan dia cekik pada the median nerve. So when the nerve is compressed kat sini, you have a certain kind of numbness. Most of the time is 3.5 jari. Little finger normally is ulnar nerve. So when a patient have this particular kind of numbness, yes, we'll release the transverse carpal ligament.
Berapa lama surgery tu, doktor?
We will give a local anesthesia. We just give a block here, and then surgery takes around 20-30 minutes. But with the current technology, things have improved a lot. Last time we have to do open big. Now we even do it by endoscope. A small incision, we do a scope and we see exactly what we are releasing. We can see the nerve and we just release it using scope.
So saya takkan ada parut dah?
A small parut, but the parut is going to be like 1.5 cm.
And berapa cepat patient boleh recover dan discharge balik?
The whole procedure will take less than 1 hour. So patient go back the same day of admission.
So tak payah bius penuh semua, tak payah, local je?
Kalau I'm doing the endoscopic release, yes, I personally prefer to do under GA because I want to keep the hand dry. Kalau saya bagi local anesthesia, the hand will be moist. So it's difficult to see. But if you're doing under local, we just open it. Still, the procedure takes around less than half an hour. Patient going back the same day.
Daycare procedure lah?
It's all daycare procedure.
Alright, okay. So I think it's an important awareness kepada orang di luar sana, sebab I know even my friends ramai yang struggle dengan sakit tu because takut tak nak go through surgery.
Yes. Just a note of that, kalau tu tunggu lama sangat, carpal tunnel tu, the nerve is compressed, cekik sangat. Cekik dekat saraf tu lama sangat, ada wasting. The muscle is get thinned out. Tapak tangan thinned out. So when you have that wasting, just by releasing carpal tunnel, you cannot solve the problem. The numbness may reduce, but the wasted muscle takkan tumbuh balik.
Tak kuat lah tangan tu.
Tak kuat lah. So the patient, first thing they lose is this motion. So they cannot do this. So when you don't have this motion, banyak daily activities limited. You want to hold something, you need to open first. So you have to end up doing another surgery for tendon transfer and all that to tackle this. But although this presentation nowadays is not very common, do not wait too long until the muscle is wasted.
Tadi doktor kata kalau buat carpal tunnel ni can discharge the same day. How long one will be on MC? Tak boleh kerja, tak boleh dukung anak, tak boleh masak if they go through the surgery?
Carpal tunnel release is basically a soft tissue procedure. I'm not repairing anything. So patient can return to his previous level as soon as patient feel comfortable. simple. The only reason why we give MC and everything because we want the wound care. We want a big MC around 1 week to 2 weeks depending on the patient and what occupation he does, and basically for the wound care saja. Patient can go back to the daily activities, carry things, everything immediately even day 1, day 2 of the surgery.
So carpal tunnel, double crush syndrome, these are some of the cases yang Dr. Silan tengok as hand surgeon.
For compressive neuropathy, most common is carpal tunnel, followed by cubital tunnel, ulnar nerve dekat siku.
We are almost going to wrap up our episode this time. Boleh tak? Because kita hidup dalam zaman digital sekarang. Almost everybody using our hands excessively for phones, for keyboards, for everything. Boleh tak doktor berikan sedikit tips dan juga nasihat kepada fellow Malaysians how to take care of our hand, the most important part of our body. Macam mana nak cegah this kind of pain? What are the red flags when you would suggest that run to a doctor, don't postpone anymore?
So hand is actually very dynamic and versatile. Unlike other part of the body, you don't really have any specific thing to take care of the hand. The hand injury we only realize when you have injured. When you have injury, then we realize, oh, I cannot do this. But otherwise, hand is actually very versatile and very specific kind of organ. For usage of handphone, there is something called handphone hand syndrome, where there are numbness when a particular position of the holding the phone, which is usually the little finger. So you arrest the phone nowadays the phone is getting bigger and bigger and bigger. You arrest the phone in the particular finger to hold it. So all these can lead to certain symptoms. You can get a lot of products to support your hand rather than using your fingers to support position of the wrist movement. And best part is when you're using a lot of keyboard and mouse, yes, we have a lot of ergonomic setup nowadays.
Alright, itu nasihat daripada Dr. Jeyasilan, pakar hand and microsurgeon daripada Columbia Asia Hospital Cheras. Banyak yang Dr. Jeyasilan dah share kan. Saya harap korang boleh tengok episod ni daripada awal sampai akhir sekali lagi untuk faham dan ambil pedoman apa yang doktor dah sharekan. Almost all many things that you mentioned were lifestyle modifications, betulkan posture and juga posisi tangan dan ergonomic setup dan sebagainya. Hopefully kita boleh ambil pedoman dan juga lebih cakna terhadap penjagaan tangan kita, the most important and the most versatile part of our body. Sehingga kita berjumpa lagi dalam episod akan datang. It is a bye from Dr. Jeyasilan and myself, Dr. Malam. Bye-bye.